Hey everybody, I'm Natalie Bencivenga, host of 5 Minutes With, and I am so excited for this week's guest. Her name is Dr. Natalie Gentile, and she is the founder of Gentile Family Direct Primary Care. How are you today?
I'm so excited to be here, Natalie, my soul sister from another mister.
I know, when I learned about you with our friend Tony Norman, I just thought, oh, she has the same name, same color hair.
Match made.
It was just meant to happen, yeah. So can you tell everybody a little bit about, I find your practice really interesting. So can you tell everybody a little bit about your family care practice that is based in Highland Park?
Absolutely. So I'm a board certified family medicine physician and lifestyle medicine physician.
Mhm.
I went through the normal training of college to med school to residency, bang, bang, bang. I went on staff at Mayo Clinic for a couple years after my residency. And when we knew we were moving back home to Pittsburgh, it became the question of what am I going to do for my job when we move back home? I was offered what would seem like a dream job at one of the bigger places where you could work here in Pittsburgh. And thankfully, I heard about direct primary care instead. And that's when I opened my own practice, Gentile Family Direct Primary Care. What really led me to want to do that is I finally had a name to how I was wanting to practice medicine this whole time. And that name is direct primary care, having a direct relationship with my patients without the middleman of insurance and big box medical systems telling you how to see a patient, how often to see a patient, and how many patients that you need to see in a day.
No, and I think that's phenomenal. And from what I read on your website, you cap it at 300 patients, and everybody just pays a monthly sort of a membership fee, and then they have as much access to care as needed, which I think is just so powerful and empowering for patients and people who are tired and exhausted of trying to navigate our challenging system. So I think that makes a lot of sense. And speaking of challenging, 2020 has been one hell of a challenging year. Would you not agree?
Turns out it has.
That's right. And one of the most challenging, and I'm guessing frustrating things for you as a doctor would be just trying to get people to understand the importance of wearing a mask. So can you talk a little bit about that from your perspective with your medical background? Why do we need to wear a mask to stop the spread or to slow the spread of COVID-19?
So when it comes to global health issues,
Mm-hmm.
there's not a lot of times where we could all do something and it could really make a difference.
Mm-hmm.
You know, it's one of those things when it comes to mask wearing where you literally, as a human being, can feel empowered to play
Mm-hmm.
your part by just wearing your mask.
Right.
By cutting down that risk of transmission between you and a person that you come and cross paths with just by wearing a mask, that's an opportunity that we should not be missing.
Yeah, and that makes total sense. And when I think about how this issue has just sort of been blown completely out of control, and this idea of, personal responsibility, but also personal space and infringement of rights and all of this silliness, it also brought attention now that there is a possible vaccine that's looking very promising to the anti-vaccination movement. And from your perspective as a medical professional, can you speak a little bit to the dangers of a lot of that misinformation of people going on YouTube and thinking now that they're smarter than or more informed than doctors and researchers that have been making this their lives work?
Yeah. I'm going to be very straightforward. This is a subject that makes me a little angry.
Mm-hmm.
By a little, I mean a lot. As a healthcare professional who's
Mm-hmm.
married to a healthcare professional who is operating on human beings in aerosolizing procedures, who has worked with countless, healthcare professionals in my training and in my current work. If you are going to go out and say that it's an infringement on your rights to wear a mask and to try and do your part to take care of society, we are all still the ones that are going to be taking care of you if you were to end up in the hospital or in the outpatient setting.
Mm-hmm.
And that's a privilege of ours, and it's our duty, and it's what we signed up for. But out of human decency, to take care of each other, if all you had to really do was wear a mask, put some of your plans on hold if it came to big, gatherings, maybe not travel and carry a virus across the country to make someone else sick, it's not a lot to ask. I think we all, just like with things like cancer or diabetes, we all know someone who has it, right? I think most of us know somebody who's in the healthcare field. You know, most of us know somebody who probably shouldn't be getting sick.
Right.
Most of us know somebody who's vulnerable to being ill.
Mm-hmm.
And when it comes to vaccines and on a broader scale right now with this pandemic, COVID, if you just think about that person next time you make the decision to not wear a mask.
Mm-hmm.
Is it really worth it?
No, and I hear that. And I think that mistrust, we were talking a little bit about this before we went live, so to speak, that this mistrust that we have both in the government, like you were telling me, is also paralleling the mistrust for the medical community. Do you think that's where a lot of this is coming from?
Yes. So I think there is a stench of mistrust across this country that is pungent. It is really terrifying, actually. I think it all comes down, honestly, to politicizing and middlemen. There's been so much over decades and decades and decades that has gotten between your relationship between you and your doctor. You know, and I think it's so much paralleled in politics, and we've just allowed this mistrust. We have people who think that they're experts, that all of it, you know, become an expert overnight. We have people who are out there spewing complete misinformation, but because we distrust our medical community, because we have so much distrust in politics and for our leaders, where else are you going to go? You know, you're going to go to what seems like it sounds right to you in your head. You know, you're going to go to, if somebody's saying something you want to hear, that's what you're going to hear.
Well, and I can totally attest to this from the journalism world. There's been so much mistrust placed now on certain publications and you know, questioning people that have once again made this their life's calling to make sure that information is vetted, to make sure that it's researched. And so I think all of these things, how we're getting our information, who we're listening to, you know, the types of decisions that we're making that are impacting not only ourselves but one another, all of those things are woven together. And I think you make a really good point about we're starting to live in these echo chambers, and it's very easy to only want to hear what you want to hear instead of hearing the full picture, no matter what the topic. But I think in particular right now, because of COVID, that mistrust directed towards the medical community is just, it's no pun intended, it's a hard pill to swallow.
Yes.
But, you know, as we move forward, the other thing that I think is pretty cool about our parallel lives that we're living is that we're both very much into plant-based nutrition. And when it comes to protecting your body against all forms of disease, or just helping to reduce the acidity in the body or reducing stressors in the body, plant-based food is really where it's at. So can you talk a little bit about how you can use plant-based nutrition to help boost your immunity while we're waiting for this vaccine?
So I have a huge crush on the gut microbiome and gut health. Yes. So, and I always say, don't tell my husband. But it turns out that 70+% of our immune system is in such beautiful, close communication with our gut bacteria and our gut microbiome in general. And so what can we do to support gut health so that we can support immune health and support an anti-inflammatory environment in our body? And it's, you know, spoiler alert, it's plant intake. Right. So it's diets that are predominantly plant-based. What does that mean? Legumes, chickpeas, lentils, beans, whole grains, fruits, vegetables, and we're talking whole foods, right? Yeah. We're not talking you know, processed and refined foods. When we get back to the fundamentals of those phytochemicals, those plant chemicals that come from a whole foods, plant-based predominant environment, that is what supports our immune health and our gut health, and therefore can help us fight disease.
I have to tell you, I'm like sweating now because I have such a girl crush on you from all this amazing information. I'm like, she's talking about the gut biome.
You had me at gut.
No, this is such helpful information, because I do think that you truly are what you eat, and let thy food be thy medicine, right? We can do all of these other things and make sure that we're wearing our masks. If we're able to have a vaccine available to us, make sure that we take that to protect those around us. And also, it's just as important what we're putting in our bodies to help support all of that goodness that can then thrive from within. And then you can kind of have that natural glow. And speaking of, as we wrap up this little bit more than 5 minutes with each other, I really am excited because you and I are talking about perhaps doing a project together in the winter that's going to be focused on mindful eating. And just to give people a little teaser, since we're at the end of 2020 thank goodness, and heading into a new year with the new year buzz around the idea of dieting and looking your best going into this year, as it is every year. What can you tell people about when it comes to diets versus the idea of mindful eating?
I always focus with my patients on what is sustainable.
Yeah.
Going on a diet is not going to be something that you are likely going to take with you for the rest, the next 50, 60 years.
Mm-hmm.
So what are sustainable changes that you can make that resonate with you,
Mm-hmm.
help you feel like a whole person who is coming out better on the other side?
Yeah.
That's what I focus on when it comes to mindful eating with patients.
Well, I can't wait to discuss that topic more with you in 2021. Dr. Natalie, I just like saying it. Thank you so much for being a part of 5 Minutes With and for sharing such important information. And I hope that we can do this again very soon.
Yes. Thank you so much, Natalie.
Thank you.